day. This is vaccination training for pharmacists under Faculty of Pharmacy, University of Lagos. We are taking team 1, which is pharmacist and public health, educating the pharmacist. I'm taking module 1, immunizations and the role of pharmacists. I'm Professor Mrs. Prof Aina, a clinical pharmacist and professor in the Department of Clinical Pharmacy and Biopharmacy at the Faculty of Pharmacy, University of Lagos, Nigeria. I have over 30 years teaching and research experience with focus on pharmacoepidemiology and many rational use of medicine, pharmacy practice, and public health research. I have over 50 publications in peer-reviewed journals to my name. I have presented papers in conferences both locally and internationally. I was Dean of Faculty of Pharmacy, August 1st, 2017 to July 31st, 2019. I've been HOD of the Department of Clinical Pharmacy and Biopharmacy several times. I'm a member of many international and national professional bodies, for example, International Association of Public Health Logisticians, Clinical Pharmacists Association of Nigeria, Association of Public Health Pharmacists of Nigeria. I'm a fellow of Pharmaceutical Society of Nigeria, fellow of West African Postgraduate College of Pharmacists, and fellow of Nigerian Academy of Pharmacy. I'm married with 3 children and a granddaughter. At the end of this presentation, the participants are expected to describe the impact that vaccines have had on public health, explain how pharmacists and student pharmacists can help to improve vaccination rates, and identify opportunities for pharmacists and student pharmacists to be immunization advocates. Introduction. Public health seeks to improve the health of the whole community, with an emphasis on protection, prevention of disease, and promotion of well-being. And the job of community pharmacists entails helping patients and the public assessing their conditions and making decisions about which medicine they should take. Community pharmacists actually play important roles in disease protection and prevention, as well as promoting well-being. Now, vaccination. Vaccination means treatment with a vaccine to produce immunity against a disease. And in some climes, it is referred to as inoculation. Vaccination can be achieved in several ways, either by oral route, for example, oral polio vaccine, intranasal route, the live attenuated influenza, by intramuscular injection, BCG, typhoid, hepatitis A, hepatitis B, etc., through the subcutaneous route, MMR, the needle-free route, which can be delivered in form of jet injector, for example, Afluria quadrivalent, which is a flu vaccine, or by use of adhesive bandage, which is undergoing clinical trials. Vaccinations are protective and can easily be achieved in the community setting. In addition to ensuring uninterrupted delivery of routine pharmacy services, pharmacists are able to respond quickly, even to fill public health during a pandemic, for example, COVID-19. Pharmacists actually stood in the gap for people in the community during that period. Pharmacists, as established advocates, educators, as well as qualified providers of vaccinations, have a significant role to play in promoting and supporting uptake of vaccination. Now, the role of pharmacists in immunization and vaccination actually varies across the world according to FIP 2016. In some countries, the pharmacists are primarily involved in ensuring the safe supply and dispensing of vaccines, as well as advocating for immunization. While in other countries, they are empowered to play a more active role. That is, they are legally authorized to administer vaccinations, manage patients' vaccination schedule, and or organize vaccination activities and campaigns. Now, vaccination policies vary across the world. The legal authority to perform immunization activities currently varies significantly across countries, and the integration of community pharmacies and pharmacists in national vaccination policies will tend to develop as a gradual process over time. For instance, Nigeria, about last year or close to late 2021, the community pharmacies are allowed to start vaccination in their community pharmacies. Though the policy is still ongoing, there are still some T's to cross and some I's to dot. But community pharmacies have been recognized as primary care centers for vaccination purposes. So strategic and integrated partnerships between healthcare professionals are increasingly common, and the role of pharmacists as educators, facilitators, and immunizers is becoming more readily recognized. Now, impact of the vaccination has had on public health. Immunization and vaccination are two of the most important public health interventions, and they actually constitute a cost-effective strategy to reduce both the morbidity and mortality associated with infectious diseases. Now, vaccination along with sanitation and clean drinking water are actually public health interventions that are undeniably, responsible for improved health outcomes globally. It is estimated that vaccines have prevented 6 million deaths from vaccine-preventable diseases annually. Actually, the most significant impact of vaccines has been to prevent morbidity and mortality from serious infections that actually affect children mostly. Vaccines are estimated to prevent almost 6 million deaths per year and to save 386 million life years and 96 million disability-adjusted life years globally. Now, there is added value to vaccination. On a population level, there is a potential to generate herd immunity. That is where a sufficiently high proportion of the population are vaccinated. The transmission of the infecting agents is altered, thereby protecting the unvaccinated, who may be those that are too young, too vulnerable, or too immunosuppressed to receive vaccines. Now, pharmacists' role in immunization. Pharmacists, as established advocates, educators, as well as qualified providers of vaccinations, have a significant role to play in promoting and supporting the uptake of vaccination. Challenges and barriers actually exist to pharmacists' vaccination activities. And these challenges are actually multifactorial, and they need effective strategies to address them. And overcoming these barriers will increase the role of pharmacists as vaccinators, that ultimately increases public access to vaccination and reliable and accurate information about vaccines. Now, pharmacists can actually administer vaccines or host other healthcare professionals who can administer vaccines, according to American Society of Health System Pharmacists. Now, the issue of hosting other healthcare professionals. I have an example in Lagos, a community pharmacy that provides immunization, but meanwhile has a nurse in place to administer this vaccine. But then for pharmacists to actually administer vaccines, there is need for legal authority or policy, which I've mentioned earlier that in Nigeria now, there's a policy in place, approving pharmacists as vaccinators in their community pharmacies. Then there's need for training, which is an example of what we're doing now. And there are other bodies that are carrying out training for community pharmacies in particular, in order to become, in order to be able to administer vaccines. Then there should be program structure. There should be a solid structure in place for the program to succeed. And then there's need for reimbursement. These services that are being provided by the pharmacy should be reimbursed. In some climes, there's program in place or process in place whereby the pharmacies are reimbursed for these services through the health insurance. I hope that will be able to function here in Nigeria as well. Now, pharmacists who do not administer vaccines can promote immunization through 6 types of activities, which are 1, history and screening; 2, patient counseling, documentation, formulary management, administrative measures, and public education. But it is worth to note that these promotional activities can also be integrated into or can accompany a pharmacy-based immunization program. That is, in community pharmacies where the pharmacists are actually administering vaccines, they can still add these promotional activities. Now, we want to go through the 6 promotional activities. The history and screening. The pharmacists can actually promote proper immunization by identifying patients in need of immunization. And there are about 6 types of screening. Occurrence screening. This happens at a site whereby maybe a patient has come to a patient clinic or is on admission. The patient are screened for their vaccination needs. Then diagnosis screening. This is mainly done for patients that have disease conditions that predispose them to infectious diseases, like patients with diabetes, asthmatic patients with heart conditions, and the rest. At the point of their diagnosis, they are also being screened for their immunization need. The procedure screening. This screening is done for patients that have come for some surgical procedures. So during these surgical procedures, they are being screened for their immunization need. The periodic mass screening. This is done during a particular program, a particular season. For instance, during the flu season, there is a mass screening for people for their immunization need. The occupational screening. Actually, this is for healthcare providers that are involved in taking care of patients under the diagnosis screen. That is healthcare providers or pharmacists in particular taking care of patients that, like diabetic patients, asthmatic patients, patients with heart condition, patients that are actually predisposed to getting infected with these infectious diseases. That is, they are at high risk. Okay, you can just say high risk patients. So the healthcare providers or the pharmacists taking care of these patients who need to have their need of immunization identified. Then lastly, screening for contraindications and precautions. Even after screening or identifying the patient's need of immunization, there's need to screen for contraindications and precautions in these patients. Now, patient counseling. Patients in need of immunization should be advised of their infection risk and encouraged to accept immunizations that they need. And also they should be counseled on why they need this immunization or vaccination so that they can be encouraged to take their vaccines. Then documentation. All healthcare providers who administer vaccines, including pharmacists in this case, should maintain permanent vaccination records, and they should report any occurrence of adverse events. And then the record must state the date of when the vaccine was administered, the vaccine manufacturer, the lot number, the name and address, and even the title of the person administering the vaccine. Then formulary management. In organized healthcare settings, the formulary system should include vaccines, toxoid, immunoglobulins that should be available for use in preventing diseases in patients and staff. And also the pharmacists in this case should ensure that the vaccines needed are identified through data gathering. Then the vaccines that are identified as being needed should be sourced for, should be in the pharmacy, and then there should be adequate distribution. And when we're talking about distribution, it also involves proper transportation. And when we're talking about vaccine, you don't just transport vaccines in any container. There is need to maintain cold chain when transporting the vaccines to the end user if you're just storing the vaccine in your pharmacy. Then it is also important that methods be established for detecting and properly disposing of outdated or partially administered immunologic agents. Then administrative measures. There is need to encourage the development of sound organization policies and protocols on immunization. For example, there should be a standard protocol on hepatitis B or rabies pre and post exposure prophylaxis. Then lastly, public education. The pharmacists actually have ample opportunities to advance the public health through immunization advocacy. The pharmacists can promote vaccination among high-risk populations. The pharmacists, especially in the community pharmacies, should seize every opportunity to advise their customers or their clients, not just patients, their clients now, coming to the community pharmacy to take the proper immunization. That is pharmacists should act as immunization advocates. The impact of pharmacists as immunizer or vaccinators. The pharmacists being immunizer or vaccinators will increase access to vaccinations. That is, access to vaccinations will be enhanced. There will be more immunity against preventable diseases in the community. There will be reduced risk to diseases of public health. And it is beneficial for all seasons, whether there's pandemic or not. Then it can reduce the burden of diseases during a pandemic. It keeps the population in a more healthy state, can facilitate awareness and prevention of diseases among the population, and of course, promotes good health habits. Conclusion. Pharmacists are health professionals who have the skills, capabilities, and logistic capacity to vaccinate. Pharmacists, as established advocates, educators, as well as qualified providers of vaccinations, have a significant role to play in promoting and supporting the uptake of vaccination. There are challenges and barriers to pharmacist vaccination, which are multifactorial, but if addressed, will enhance access to vaccinations and reduce risk to diseases of public health. These are some references that you may be interested in looking at further. Thank you.